everyone, my name is Lexi. I'm a medical student at the University of Vermont. This is the second video of a 4-part mini-series on mental health and well-being in the times of COVID-19. This video will explore the impact of COVID-19 on healthcare workers and the general population. How does taking care of patients with COVID-19 affect the mental health of frontline workers? A recent study surveying healthcare workers found that individuals in direct patient care of COVID-19 were more likely than second-line workers to report symptoms such as depression, anxiety, and insomnia. In the United States, healthcare workers on the front lines caring for patients with the novel coronavirus have been dealing with a critical shortage of personal protective equipment, or PPE. Lack of proper PPE increases the risk of disease exposure and serious illness. According to GetUsPPE.com, over 50% of healthcare institutions across the country have less than a 1-week supply of N95 masks available. In addition to working long hours, many healthcare workers are staying in temporary housing, fearful of infecting their loved ones if they go home. Many hotels have stepped up to provide temporary housing for this population. Self-isolating and lack of family support further increases the risks of adverse mental health symptoms. CDC data shows that between February and April 9, 2020, over 9,000 healthcare workers in the United States have been diagnosed with COVID-19. The burden of taking care of friends and coworkers can increase the emotional burden on healthcare workers, especially when the outcome results in death. A growing list of healthcare workers who have died of COVID-19 can be found on Medscape. The National Emergency Declaration due to COVID-19 pandemic has also resulted in changes across the country that impact all Americans. Closing of non-essential businesses has resulted in over 22 million individuals filing for unemployment. Unemployment can result in increased rates of anxiety, depression, and lower self-esteem. Social distancing, while necessary at these times, can also lead to increased feelings of loneliness, especially when our normal social support systems have been taken away. Families are also at risk, especially with children out of school. Without access to schools, children are at risk for decreased access to food, counseling and academic support, along with lack of peer support. If you or someone you know is having a hard time, please reach out for help. Here is a list of available resources, which is also available in the video description. You are not alone.